I stepped up to the microphone. Hello, my name is Dr. Yelba Castellon-Lopez. I'm a physician at UCLA. The room was filled with community members, advocates, and representatives for the oil drilling company. My voice began to tremble, and I could feel my heart pounding in my chest. My eyes watered as I looked down at my 8-month pregnant belly. The 2-minute timer started. I took a deep breath to regain my composure. I'm a physician and a community member, and I live less than a mile away from the Jefferson drilling site. When I moved to South Los Angeles, I was a 4-year-old girl from Nicaragua. I grew to love and appreciate the diversity in my community, but when we moved into our home and started our family, I never imagined it could be in such close proximity to an active oil drilling site. In medical school, I learned about physical health and some of the health disparities affecting my community. I was inspired to do my part. I quickly realized that doctors, confined to an exam room, often struggle to make an impact on the outside forces that shape patients' health and well-being, such as their environment. I was still standing at the podium when I realized I couldn't share my 2-page testimony in the minute and a half I had left. I put down my notes and began to speak from my heart. 4 months ago, I got home, and the smell of chemical fumes was so strong I had to take my small children and go to my mother-in-law's house. I feel lucky that I have the option to leave, but I know that some of my neighbors do not. Communities of color in Los Angeles have a long-standing history of carrying a disproportionate burden of disease, and it's these same communities that lack the protections that have been afforded to more affluent communities with drill sites. The city of Los Angeles needs to do better. We rely on our elected officials to help protect our communities and to protect our children. The timer was up, and I walked back to my seat.